Hey guys, so today is Wednesday. We had a lot of craziness come through urgent care today, which is where I was working. Um, like stuff that really shouldn't have come into urgent care. They really needed to go to the emergency room, and a couple of them we actually did end up sending them to the emergency room. It was just like the clinic that I work in, we do not have the ability to do IV hydration and stuff like that in the clinic. Like, they have to go to the ER or to our infusion room in order to get that sort of thing. And a couple of them today came in because they felt like they were dehydrated. Someone had been throwing up for days. Like, why are you coming here? Skip us and go straight to the ER. We also had a level 2 trauma come into the hospital today, not in the clinic, but I was bringing a patient down to the lab and kind of had to stop in my tracks and allow everybody from the other departments that need to respond to those traumas. I had to let them pass in front of us on their way to the emergency room. Yeah, I don't know. I feel like the next 2 days are going to be super boring and probably going to move super slowly because I'm afloat for Thursday and Friday of this week. And what that means is you're just kind of helping wherever anybody needs help. If nobody needs help, then you just kind of sit there and make phone calls and let people know about their test results, or like communication from the provider to the patient, stuff like that. Today wasn't too bad. We saw, like, today was the busiest that the urgent care slash same day clinic, like, it was so busy compared to any other day this week and most of the days last week. So of course on the day that I'm working there, it's not super chill and laid back. It's kind of in and out all day long. Not that that's a bad thing. It still wasn't anywhere close to the number of patients that my normal provider sees every day. Like I said, it's definitely going to be a culture shock going back to working with him on Monday. So yeah, but anyways, I know this is super short, but yeah, I don't really have a whole lot to tell you. Sorry, but I guess I will be back tomorrow to tell you how floating day number 1 went. So yeah, I'll see you tomorrow. Hey guys, so today's Thursday and I just finished day 1 of my little floating adventure this week. My provider actually came in, even though he's still on vacation. He came in to sign off on some prescriptions and get them sent into the pharmacy. And then he also did an injection, a joint injection, while he was there. So I drew up the medication for it and got everything ready. The only thing I forgot was the iodine swab, so I kind of felt a little dumb that I forgot that. But out of everything that I could have forgotten, I feel like that is the least of my worries, is the iodine swab, because we keep them in one of the drawers in the exam room anyway. So he didn't really make a big deal out of it. He just let me know that that's what I forgot. So anyways, everything went smoothly. I did a lot of patient phone calls about results and prescriptions and things like that. I didn't really do much else. I did help with like the same day clinic urgent care walk-in. I helped room a couple of their patients and did some rapid strep tests and stuff like that. But other than that, I really didn't have too much to do. I also picked up a couple of shifts and a couple extra hours. Like, one day next month, I'm gonna close. So that means I'll stay there until the clinic is closed, which normally there's one nurse that stays like Monday through Thursday. She will stay until the clinic closes, but she's off that day, so I'm gonna cover closing the clinic on that day. So I guess. And there's another day that I'm working for a different provider because they're floating someone else. So since my provider technically has 2 nurses, myself and another one, they're having me cover the other provider since they're floating the other person, if that makes sense. Since we have 2, they can switch and flip-flop, whatever. So I'm doing that a couple days, and there's a couple days where I'm covering urgent care, same-day clinic, walk-in clinic, whatever you want to call it. There's a couple days that I'm covering there instead of my provider. So again, for the same reasons, but it is what it is. I'm willing to be flexible to wherever they need me to go. I'm fine with that. It's just part of the job, I feel like. So anyways, tomorrow is another day of floating, so it's probably going to be the same. Hopefully a chill Friday, and then I'll be off for the weekend. So I'm looking forward to the weekend. I don't know what my hair is doing. It's driving me nuts, especially because I feel like it's off. Like the length is off in some spots. I don't know. Anyways, I hope you guys are having a good day. I am. Anyways, I'll be back tomorrow to give you a recap of my day. Ugh, it's been a day. Anyways, see you tomorrow.